Welcome everybody to the Fasting Transformation Summit, where we are uncovering the most ancient, inexpensive, and powerful healing strategy known to mankind, fasting. I'm your host, Dr. David Jockers, and I've got a great guest today. This is Dr. Jack Wolfson, and he is a board-certified cardiologist who grew tired of patients failing to truly get well using pharmaceuticals and procedures. As a result, he opened Wolfson Integrative Cardiology, where he now uses in-depth testing and targeted nutrition to prevent and treat cardiovascular disease. He treats the whole person, getting to the cause of the issue instead of treating only the symptoms. Dr. Wolfson offers practical solutions for heart health in person at his office in Paradise Valley, Arizona. Love the weather in Arizona, so no wonder why it's called Paradise Valley out there. He's the author of the Amazon bestseller, The Paleo Cardiologist, a great book that I personally have and a fantastic guide to improving your overall health and lifestyle and certainly to improving your heart health. So Dr. Jack, really great to have you on today with us.
David, it's fantastic to be on with you. I'm just so impressed with all the content you put out there and really trying to bring this information of health and wellness to the entire world. And I think it's exciting times right now. The health revolution is on. I came from the medical sickness model and I saw so much sickness, so much disease, the pills and the procedures, and nobody's really getting better. And to come over to the health and wellness side, to be around luminaries like yourself is really exciting for a converted cardiologist like me.
Well, thanks so much. I appreciate that. And by the way, if you were wondering, Dr. Jack is actually a phenomenal dresser. In fact, in our Keto Edge Summit, he actually had a suit on. It looked awesome. He's actually traveling with his family just literally around the country. You're in Colorado right now, and you guys are, in a sense, just looking for really direction as far as where you guys are going to live. Is that correct?
Well, life is about, change. And we've been in Arizona for 16 years. I spent 30 plus years in the Chicagoland area. And I think we're ready for our new chapter. And one of the things we're excited about is really being able to really take health to a new level for us. And that is to find, some acreage where we can have some farm animals and green grass and the outdoor lifestyle to be able to really embrace all things health and wellness. But yeah, as far as my t-shirt, this morning, you kind of caught me a little bit off guard. So I'm wearing my Wolfson, the Doctor's Wolfson proprietary t-shirt. So a little shameless marketing here, not on purpose, but it is an organic cotton t-shirt. I am in organic cotton shorts as we speak. I will let the audience leave that to their imagination, but ready to roll and really bring it to everybody.
Well, cool, man. Well, tell us your story. I know that your wife is a chiropractor who's amazing woman. I know I've met her at different conferences, and you guys are such a great couple. And tell us your story really about how you became a cardiologist, how you met her, and how you transitioned into integrative cardiology.
Yeah, most certainly. I became a cardiologist like my father before me. My father was the first doctor of osteopathic medicine at the Cleveland Clinic in 1970. 1972, the first DO in cardiology at the University of Iowa, a very, very prestigious cardiology institution. And then 1975, he became the head of cardiology at the Chicago College of Osteopathic Medicine, obviously in Chicago. And I totally followed in his footsteps, not because I had any love in particular for osteopathic medicine, but it's just what he was, what all of his friends were. That's all I knew. So I went down that path as well. So I become a cardiologist, but simultaneously I see my father getting sick. And in his mid-50s, he's diagnosed with depression, and then that turns into Parkinsonism, and then eventually to a diagnosis called PSP, or progressive supranuclear palsy. And at the Mayo Clinic, they tell us we have no idea why he has this. We have no treatment for it, and he'll be dead within a few years. And my father died a tortuous, cruel death within those few years, and nobody could do a thing about it. Nobody knew why. And then I meet this 20-something-year-old doctor of chiropractic, and she, Dr. Heather, tells me exactly why my father got sick. She tells me exactly all the causes of his illness. And what she said made perfect sense. So here's this young doctor of chiropractic She knows all the reasons why. Mayo Clinic has no reason why. And what she said, like I said, made perfect sense. And I started to listen. I started to change. We quickly fell in love. We quickly got married. We quickly had a beautiful family. And it led me to open up our own practice in 2012. I eventually left the biggest cardiology group in the state of Arizona, for which I was a senior partner, making big time cardiology dollars, bilking the medical system, bilking the insurance industry for everything possible. I opened up my own practice, and it's been a whirlwind ever since.
Wow, powerful stuff, powerful story there. And just, a great sense of humility on your own part to not think that you had it all figured out, and to be humble enough to listen to your now wife. And so,
well, listen, it's just, you see so much sickness in the cardiology industry, and the hospital is a revolving door of sickness where somebody comes in, they have a heart attack, they're in congestive heart failure, they had a stroke, whatever it may be, and then you quote unquote tune them up, and then you send them out, and then a few months later they come back in with the same problem or a medication complication. There's so much sickness and misery in that industry. So to be enlightened by what is really common sense, right? David, when you and I have these conversations, it's just common sense type things, but medicine has lost all common sense. They've lost all of their ability to be rational thinkers as to why people have problems. And it's just, you get into this 10-minute patient visits. Here's your pills, here's your prescriptions, here's the tests I want you to do, and good luck type philosophy. And it's such a failure, and the public has awakened to that failure.
Yeah, absolutely. Totally agree. And so so now that you're practicing integrative cardiology and really getting to the root cause, let's go over what the major root cause of heart disease really is, and how lifestyle plays a role in that.
Well, it's back in the 1990s when I was in medical training, it was all about the Human Genome Project. And we're going to learn about the genetics, and we're going to find out why people have disease based on their genetics. And what we learned from that is that genetics has nothing to do with disease. It's all about how the environment affects our genes, affects our body, excuse me, and then leading to disease, whether it's stroke, cancer, heart failure, dementia, you name it. So what we try and do now is that we try and teach the actual cause of cardiovascular disease. And we talk about the importance of sunshine as fundamental. We talk about the importance of sleep as fundamental. We talk about the importance of organic food as fundamental to prevention, to getting stress out of your life, to increasing physical activity, not hitting the gym, for an hour on the treadmill while you're watching CNN. That is not healthy physical activity. We talk about the importance of chiropractic care as foundational for cardiovascular health and wellness. We talk about, once again, getting those chemicals and toxins. We talk about evidence-based testing. We talk about evidence-based supplementation to supplement the healthy lifestyle. So when you do all those things, you really are able to prevent cardiovascular disease on a meaningful level, because we know that the statin drug model is a failure. But when we talk about statin drugs at best lower the risk from here to here. That's not good enough, David. You know that. That's not good enough for you, for your family, for me, my family. It wasn't good enough for my father. And we don't want them from here to here. We want them to zero risk. And we know their side cannot do that. We know their side fails. We know their data on their side. And clearly our side is so much better, because the body is built to be healthy. The body wants to repair damage. The body always wants to heal. And it will if we just get the chemicals and the nasty lifestyle out of the way.
Yeah, absolutely. Because ultimately, bad lifestyle leads to inflammation. Right? And we know that inflammation just damages up the endothelial lining of the blood vessels, and obviously can cause a whole lot of different cardiovascular complications. And so, you talked a lot about lifestyle factors. Let's go into fasting. Well, how does fasting really improve? Can it improve our heart health? And, basically, what have you seen with patients when they implement an intermittent fasting style of life?
Most certainly. Intermittent fasting is a big part of my practice. And I've learned a lot of this stuff from luminaries like yourself and our mutual friends, like Dan Pompa and other people in the space that are doing some of this, great work. And really, it just comes back to, what makes common sense. And obviously, from a religious basis, really, there's such foundational benefits and knowledge of fasting. And when it comes to fasting and the cardiovascular literature, there's plenty of information in there on how intermittent fasting helps to improve blood pressure, helps to improve blood sugar, helps to improve inflammation, oxidative stress, how it helps to improve weight and weight loss. And when you start to put all these factors in together, there is a tremendous benefit to intermittent fasting. And then, of course, is that, post-stroke and post-heart attack, there's actually evidence that shows improvement in heart function, stroke recovery, when you put patients or even lab animals on an intermittent fasting program. So the literature is just rife with information that really helps, regarding cardiovascular health.
Yeah, absolutely. I mean, fasting is such a powerful way to reduce inflammation in the body, stimulate hormones that are going to help with tissue repair, right? So it can be really, really powerful. Now, what have you seen as a cardiologist working with patients? I'm sure you have a good percentage of your patients are coming in overweight, but you also have other people that are coming in normal weight, even underweight. What have you seen as far as fasting strategies for different folks?
Well, yeah, and let me say this too, is that, the medical doctors know that inflammation is a problem. This has been well documented. And if you pull any cardiologist off the street, they're going to tell you that inflammation is a problem and we have to deal with it with statin drug therapy and aspirin. But obviously that does not address the cause of inflammation. They still have no idea what the cause is of inflammation. And obviously you talk about things like leaky gut, you talk about environmental pollutants coming in through the skin, through the lungs, through the gut, and that all leads to the body becoming irritated. The immune system, just goes into a hyperdrive, and it's the immune system that creates all that inflammation, creates all that oxidative stress. So what we need to do is reverse engineer it and stop what is causing the immune system activation, and then you will stop inflammation, so on and so forth. But to answer your question regarding intermittent fasting, I think, number one, intermittent fasting to me is a great way to break nasty habits. It's a great way to reset the system so we're not craving ice cream and cookies and cupcakes and alcohol. It's a great way to, once again, get people to break that chain of events. That's number one reason why I like intermittent fasting. But strategically, when I use it in my office, it's a great way to get people to lose weight. And once they start to lose the weight, then all those other things fall into place. The blood pressure comes down, the markers of inflammation come down, the blood sugar naturally comes down, insulin comes down. And once we start to do that and the patients see the results, not only in the way that they feel, but also in the blood testing that we do, they get very excited by this approach. And I love the idea of using intermittent fasting for example, I start off people and I have them do a 24-hour. So what we'll have them do is that Saturday night is their last meal. And then Sunday morning they wake up and it's water, for breakfast, water for lunch, water all day long, and then have a sensible dinner on Sunday night. And then the next thing I take them to is a 36-hour, where on a weekly basis they do their last meal is on that Saturday night, and then it's water all day long, all Sunday night, and then they wake up to a green juice on Monday morning. And I find that very easy to do that on Sunday as a day of rest, telling people, hey, just take it easy, read a book, go for a walk, take a nap, watch a movie, watch some comedy on TV or on a podcast or something like that, just to really make a light sense of the day, spend some time with friends. I don't know about you, Dave, and your experience with your patients, but I'm sure it's similar. It's very difficult to do the fasting, especially at beginning, while you're trying to work, while you're really busy. You want it to be a day of relaxation and recovery.
Oh yeah, absolutely. That's the case. And it's even better when the sun is out. You can get out in the sunshine. Just the cravings, the desire, the dopamine hit that we get from eating, that is a really tough impulse to get around. And so when we get out in the sun, especially for grounding, barefoot on grass, dirt, sand, it really helps to get a good neurochemical release. So we just feel good, and we don't have quite the same emotional and really neurological dependence on a dopamine hit coming from food. So absolutely creating a time and a space, especially when you first get started, to where you don't have to think about work and performance and things like that can play a huge role with this. And I love what you brought up there in the beginning there. You're talking about that concept. I've heard you talk about this before, leaky gut, leaky heart, right? And so we know fasting is a great way to help seal the tight junctions in the gut, because it takes stress off the gut. And every time we eat, when we've got, really compromised digestive system, we're just going to create more and more inflammation and tear up the gut lining. And so, you've really pioneered this idea that, heart disease very much, there's a huge component of leaky gut that plays a role with heart disease, right?
Yeah, most certainly. It's just it's very clear from the literature, and it's really exciting to see how for example, elevated zonulin, which is a protein that controls the tight junctions in the gut. So the zonulin is the protein that lets things into the body that belong. But if there's too much zonulin, then it's like a wide open floodgate, and that clearly is linked to increased cardiovascular risk in the literature. In addition, you look at things like lipopolysaccharides, which are part of the cell wall of gram-negative bacteria. And when those get into the bloodstream and it's measurable, that is, once again, markedly linked to cardiovascular risk. And that also plays a role in what's called leaky teeth. So when you have those leaky teeth from obviously from metal amalgams, from root canal teeth, from infected teeth, infected bone, all those bacteria get into the blood, and that bacterial overload, once again, leads to immune system activation, which leads to inflammation, oxidative stress, and then eventually disease. But when you have all those components floating around, well, now you have that leaky endothelial lining in the blood vessels, and now all these damaged lipid particles get into the blood vessels, and now the immune system comes in to kind of clean that up, and then boom, you have disease. And the cardiologists just don't get that whole phenomena. And then what my favorite testing is regarding leaky gut is looking at anti-actin antibodies, where it's evidence that your immune system is actually attacking heart muscle protein. And that is just kind of holy grail cardiovascular information. And when you talk about all these things, where do statin drugs fit into this model? Where does aspirin fit into this model? Where does ACE inhibitors and angiotensin receptor blockers and beta blockers and all these other pharmaceuticals and the newest, PCSK9 inhibitors for $15,000 a year, where do they fit into this health and wellness model? And obviously they don't. So leaky gut is so fundamental, healing that up. And like you said, intermittent fasting helps you to heal the gut because it allows the body to take some time off to repair. And then also there's literature that says that intermittent fasting is beneficial to the gut microbiome. And if the gut microbiome is healthy and it's therefore producing things like butyric acid, butyrates to nourish those colonic cells, you're going to heal the gut and therefore heal the heart. And it's so, so simple. We're not talking about any, and this is free, right? David, I know you talk about this and other, intermittent fasting saves everybody money. You just cut out 15% of the food budget. If you do it, like I said, once a week, you're cutting out all that food budget. And then if you go on extended things like you talk about and other people on the summit talk about, wow, it's really it's so empowering for me to be in this space, to wake up from where I was to where I am now, talking with luminaries like you and others on the summit. It's just so amazing.
Yeah, absolutely. One of the biggest objections people like you and I get is healthy lifestyle is expensive, right? It's expensive to buy organic food. It's expensive to buy supplements. And, number one, we always have to look at it as an investment. Because we want to invest in ourselves, but implementing fasting helps reduce that bill down significantly. And so that's what we're focusing on here. Now, let's talk about a little bit about the concept of autophagy. So for those listeners out there, autophagy is basically when the body repairs cells from the inside, and fasting is one of the great inducers of autophagy. How do cardiovascular, let's say like the endothelial lining or even, actual heart cells, how do you know anything about how they're impacted by autophagy?
Oh, most certainly. Listen, as you said, any every part of the body has significant turnover. Even brain cells, we now know, have significant turnover. And the concept of autophagy, where the body basically targets those cells for destruction and termination and rejuvenation, and all that stuff can be improved by intermittent fasting. So one of the things that so many people talk about these days are stem cells, and stem cells are those bone marrow cells that can become new cells around the body wherever they're needed. So when you talk about the endothelial lining, the lining of the blood vessels, the lining of the blood vessels is constantly repaired, just like the lining of the gut is constantly repaired. Well, when those old cells are damaged and have done their job, well, they need to be removed and they need to be replaced. And intermittent fasting can increase stem cell production and stem cell function. So, and once again, it just goes to make, it just all stems from common sense. Now, there are other strategies we can use to increase stem cell production. As you mentioned, just going out in the sun is going to stimulate stem cell production. Walking, standing barefoot. I don't know if there's much in the way of literature. Maybe we can extrapolate some things on that, but once again, it just makes common sense that electromechanical rejuvenation from walking, standing barefoot on earth, will make a difference there. But intermittent fasting, clearly, autophagy, destroying those old cells and those organelles, as well inside the cells, all those things that help to repair will be enhanced by intermittent fasting.
Yeah, absolutely. And so, this is a way that we can really repair ourselves. I know there's no research on this, but I'm interested in seeing if somebody has an aneurysm and they start applying some sort of a intermittent fasting lifestyle, maybe even an extended fast for, let's say, 7 days, once or twice a year, what would happen over 10 years to that aneurysm? I would be really interested to kind of see something like that.
Well, an aneurysm obviously is a saccular dilation of an artery, and it can occur in the ascending aorta. It can occur in the transverse aorta, descending aorta, and then the most common would be an abdominal aortic aneurysm. You can even have some in the legs, and certainly there can be brain aneurysms. But I would certainly agree with you is that, that is happening for a reason. We are not genetically programmed to have those things. We know there's certain risk factors, whether it's hypertension, smoking, environmental pollutants and toxins that are involved in that. But I would certainly agree with you is that if we employ strategies like intermittent fasting and all the other things that go along with a healthy lifestyle, you're giving the body all the tools it needs to repair and maintain the tissue integrity of the blood vessels. So, the blood vessel has 3 layers, the intima media and the adventitia, and all those areas will improve and strengthen if we have new stem cells going into there, if we have the energy from the sun coming into the aorta and to the blood vessel linings. That's all going to increase energy production and function and nitric oxide release. All those things are all important. And I would agree with you that you take any health parameter, even coronary artery disease, that the body will start to clear out all of the arterial disease. And let me say one more thing is that we know intermittent fasting improves HDL numbers and HDL functionality. So when you have more HDLs and you have more HDL function, it goes after all of that excess cholesterol in the macrophages inside the blood vessels, clears it all out, and it will reverse coronary artery disease.
Wow. Powerful stuff. Really, really fascinating. And so, Dr. Jack, how do you personally implement intermittent fasting?
Well, me personally, I love the idea of the once a week 36-hour fast. That is my personal favorite on how I do it. I've done some extended juice fasts. I've done 7-day juice fasts. And I think anybody who comes out of it, to a person, they say they feel amazing when they do it. And then once again, we all, tend to fall back into some bad habits, and then you need another fast to kind of, break you out of those bad habits. But I love the 36-hour. Last meal is a healthy meal on Saturday night, and then just drinking water all day long and relax. I love the idea of getting a massage on a Sunday afternoon. Like we can have someone come to the house, or I go somewhere just to, relax for 60 to 90 minutes. And then I drink a lot of water. One of my favorites is Pellegrino water. Pellegrino water is very high in sulfur, and sulfur leads to glutathione production, the body's main antioxidant detoxifier. So I love the idea of that. And of course, high quality water throughout the day. And then waking up Monday morning, and I just have either a fresh greens juice or a reconstituted powder. And then maybe after that, I have a handful of nuts and seeds or an avocado. And it's really just a great strategy. Sunday, it's super easy to do. And anybody can do it. What you talk about, people with, on pharmaceuticals, people on all these different supplements. I think, certainly if you're on a bunch of pharmaceuticals, talk with your medical doctor to help them guide you through it. People that are on diabetes drugs, their blood sugar is really going to drop certainly if they're on insulin. So they'll want someone to guide you through that. But there's some great guides that are out there in your area, either a doctor of chiropractic that practices holistically, a naturopathic doctor, a holistic MD or DO. Find your guide to get you to health and wellness. The conventional MD will just lead to unhealth and death and destruction.
Yeah, totally. And if someone's out there who fears fasting, what would you say to help encourage them to get started?
Start slow. Maybe it's skipping a meal. My favorite meal to skip would be dinner. I think that the literature also really supports the early feeding mentality. So it's like, you wake up and your biggest meal is breakfast, and then you have a reasonable lunch. And then I would skip the dinner. So that leads to an 18-hour fast. And a lot of people, as you know, do that on a daily basis, where they have the big breakfast, they have a sensible lunch, and then they're done. So they're basically eating in that 6-hour window. And then that leads to just tremendous results, because how many people do we know they either skip breakfast, or it's a high carb breakfast. It's it's the average lunch, and then they have this massive dinner, and then you crash. After you have your ice cream, you go to sleep, and that's the cycle everybody's in. So my preference is to skip dinner, and maybe if that's one way people can get into it, is really just start off by skipping that one meal, staying well hydrated, trying to stay relaxed, keep your mind busy, and just know that you can do it. There are millions of people have done this for years and years and years. You can do it. You can do it.
Yeah, absolutely. I love that. And really the reason why we all exist right now is because our ancestors had to do it. So they paved the way, helped, basically our body have the genetic potential to do this. And so we don't have to fear it. We just need to prepare ourselves. Just like you said, prepare our mind, have a good strategy as we go about it. And, and then just get started and start to experience it. And so, Dr. Jack, this has been an awesome interview. And where can people find out more about you?
Our website is, Dr. Heather and I, it's thedoctorswolfson.com, and doctors is abbreviated DRS, thedoctorswolfson.com. We're also on Facebook, other social media. My book is, of course, available on my website. I would love for anyone to come purchase the book on my website as opposed to Amazon. Amazon has enough money, I think. Come to my website and get the book from me. You're welcome to do that. But, David, I so appreciate being on another one of your summits, and I get such great feedback from people that listen to your summits, to your content. And I'm just so excited to be part of the health revolution, and I really do appreciate you having me on.
Well, thanks so much, Dr. Jack. It's really an honor. You have absolutely been one of my best guests on the Keto Edge Summit, as well as this Fasting Transformation Summit. Love having the conversations with you. Just love the science you go into, but also just the practical application, and really keeping it simple and just realizing, hey, this is an ancestral way of life. And I would highly encourage anybody that's out there to purchase his book, the Paleo Cardiologist, right?
Yeah, yes, the Paleo Cardiologist. Yep, the natural way. And no matter what type of diet you follow, what I say in there is to eat organically. So whether you're a vegan or you're keto or you're paleo, eat it organically. Even if you want organic, cookies, cupcakes, and ice cream, they have that out there. They have any vice you have, coffee, alcohol, they have it out there. So just go get it organically. My book is all about 17 chapters, The Natural Way to Heart Health. That's what it's all about.
Yeah, absolutely. I would highly encourage it. And so thanks so much for being on with us, Dr. Jack. And for all the listeners out there, I want to remind you of this, that fasting really unlocks the dormant healing potential within us. It's safe, it's powerful, and it just might transform your life. So go ahead and get started. We'll see you soon. Be blessed.